All right, it looks like majority of the folks are seated. My name is Brandon Garrett. If you don't know, I work with Dr. Gary Puckrein and team at the National Minority Equality Forum. It is great to have you here with us tonight. We are mostly seated, so let's just give everybody a round of applause for that. We're looking forward to a good night. I'm going to go ahead and pass it on to Brandon Webb, who's introduced our host.
Everyone looks great tonight. Let's give yourselves a round of applause for that. All right. I love all my beautiful people. So we have a very dynamic MC tonight, one of my favorite people in Washington, D.C., a young man who is definitely an up-and-comer, doing big things. You may see him from time to time on MSNBC, CNN, Fox News, and anywhere on U Street. So without further ado, Don Calloway.
Good evening. Two quick clarifications. Number one, I hang out on H Street, not U Street, sir. And number two, no more Fox News. Forgive me. MSNBC only. Now, before we get started, there are people here, brothers and sisters with us, who got here way before we did to set up, and will be here long after we're gone to clean up. And I want to make sure we acknowledge and show our love to our servers who are helping us out. Thank you all so much. Had to take a step back. I am not nervous, but it's been a while since I've worn this tux. Hashtag waiting to exhale. Several members of Congress with us here this evening. And of course, all of us are here because we evolve and revolve around the circus. Want to acknowledge a few of them. Former member from the Virgin Islands, Dr. Donna Christensen is with us. We're very proud, as Congressional Black Caucus followers and devotees, we're very proud of the major committee chairs that we have as we've moved into the majority. I'm sorry, we're nonpartisan. What is we, right? But as most of the members of the Congressional Black Caucus have moved into the majority in this, the 116th Congress, we have 5 major chairmanships. And one of our beloved chairwomen is with us here tonight, the gentlelady from Dallas, Texas, the Honorable Eddie Bernice Johnson, Chair of the Science, Space, and Technology Committee. From the great city of Chicago, little sister city to my hometown of St. Louis, is chairwoman of the CBC Health Braintrust. That's a free one to you pharma lobbyists. She's right here, the chairwoman of the CBC Health Braintrust, Miss Robin Kelly, from the great state of Illinois. And my cousin, the chairman of the Healthcare Subcommittee, vice chairman of the Healthcare Subcommittee of Energy and Commerce, the all-powerful House Committee on Energy and Commerce, the gentleman from North Carolina. Before y'all give him an applause, G.K. Butterfield is here. So unfortunately, this really unfortunate, dangerous scourge of white supremacy is on the rise. We saw today the House Judiciary Committee held a hearing on white nationalism and so on and so forth. And I have been working through a solution, a fix for many years now. And I've talked through it with my cousin, Congressman Butterfield. I can't convince him to help me with this. But I think that we could use him to infiltrate Klan meetings. Once y'all see him, you'll understand the joke. My cousin from the great state of North Carolina, Congressman G.K. Butterfield. Thank you all so much for being here with us. Thank you to Brandon and Brandon LLP, who y'all heard from earlier, for inviting me to be here. Brother Puckrein, I hope not to embarrass you or my mama. And here we go. NMQF, I would not have missed this because I understand the code. Anything that starts with national, I'm there, right? I get it. If you don't get it, we'll talk afterwards. But y'all's work is so important. in a data and analytics driven world, we need data that ultimately works towards the great picture outcome that Black and minority lives still matter, that zip codes should not determine healthcare outcomes. And that is what Brother Charles Puckrein dedicated his life and career to so many years ago with the founding of this family. Please feel free to applaud. That's what he dedicated his career to. And we are grateful that he has done as much. I will not keep you all too long. I feel like I'm getting a sense of the room, and I understand what most of you all are thinking. Bakari wasn't available. I get it. Bakari's got new twins. He's knee-deep in diapers. Brother Roland Martin is getting fit for his very first ever neck, so we're excited about him. Excited about that opportunity for Brother Roland. But I will hopefully be a workable stand-in. That was rough. That was risky. Whew. I'm going to sit down and exhale, but we will first have our invocation by Alan Ryan of Sandoz, followed by greetings from the President, CEO, and founder of the National Minority Quality Forum, Dr. Gary Puckrein.
Good evening. Let us pray. Dear God, you know that each of us on some level is a patient or will be a patient, or we are taking care of a patient. Lord, we just ask, Lord, that you would strengthen us all, Lord, that we might better take care of ourselves and our loved ones and our nation. Lord, we thank you, Lord, for this gathering and everyone who is here and who is serving today. Lord, we thank you for the food that we're going to receive and the words of encouragement that we will receive and instruction. Lord, we thank you for those who put this all together. Lord, we know that a lot of hard work went into it. So Lord, we just pray that each household here would be blessed. Lord, we thank you for all of your many blessings on our lives. And we just pray that we come together as a nation to see about our own selves. Lord, we know that we can do better. Lord, we thank you again for your manifold blessings on our nation and on our lives. In the matchless name of Christ we pray, amen.
Good evening. So this evening is about present and future. And you'll understand that as we move through this evening. But I want to take just a couple of minutes to introduce you, to those who don't know us, to the National Minority Quality Forum, its staff, and what we do. So we've been around for 20 years. We got started in 1998, and our focus was on collecting health data. And what started us down that pathway was the federal government in 1998 launched Healthy People 2010, and it said we were going to eliminate health disparities by the year 2010. I was new to Washington, and so I was under the impression that when government said we were going to do something, we were going to get it done. And so it didn't dawn on me that maybe not so much. And as I looked at it, I said the contribution that I would like to make is really collecting health data for that effort. And the reason why is, just going to throw a couple of quick numbers before dinner. There are 38,000 zip codes in the United States where people live. 70% of African Americans live in 2,500 zip codes. 70% of Hispanics are in 2,500 zip codes. 50% of Asians are in 1,500 zip codes. So roughly 8,000 zip codes around the country is where minority populations reside. And nobody had collected that data on those zip codes, so we decided that was what we were going to do. But we added a little twist. We said, we're not just going to collect it for those 8,000 zip codes, we're going to collect it for the whole country. This is back in 1998, and there were little tiny computers back then, but we set out on that mission. We've been doing that for 20 years. We've built a database now of 5 billion patient records. We collect data on 100 million lives a year, looking at 72,000 conditions. We've been using that data to partner in community with patient advocacy groups. And the reason why we're doing that is because as we move into the world of big data and augmented intelligence, et cetera, we want to make sure that the community voice doesn't get lost, that the community is empowered to be able to make change, and we can do something about what we set out to do in 1998, which was to eliminate health disparities. So I've been blessed by an extraordinary team. You met Brandon Garrett just a while ago. He's largely responsible for this meeting today. Other staff members, Laura Lee Hall, if Laura Lee's back there somewhere, she runs our organization called Sustainable Healthy Communities. Jeannie Rignati is part of her team. Just stand up and wave a little bit. Gretchen Wortman does policy for us. Tom Wallace has come aboard. He's not here this evening. He had to be in New York, unfortunately. But he's leading a whole initiative for us in which we are networking and bringing patient advocacy groups together. So I've been blessed by an extraordinary team. This evening, you're going to meet some extraordinary young people, and you're going to meet a very, very special guest. So I'm going to stop here, and I'm going to ask Congresswoman Kelly to come up and say a few words.
Good evening, honored guests. To my fellow members of Congress, healthcare leaders across all sectors, loved ones who join you, and to the 2019 cohort of 40 under 40 leaders in minority health, welcome to the evening awards gala of the 16th Annual National Minority Quality Forum and Congressional Black Caucus Spring Health Braintrust. Thank you for being here. I want to acknowledge my friend, the visionary Dr. Gary Puckrein, and the NMQF staff who are consistent partners of the CBC Health Braintrust in our fight for health equity. And I don't know if he left the room already, but today is Brandon Garrett's birthday, so we have to make sure we say happy birthday. He's usually somewhere exotic, but he's here with us tonight, so happy birthday, Brandon. If you have been with us for the last 2 days, then I trust you have been enriched and invigorated by our dialogue on everything from the significance of building on the ACA, which I and my friends Rep. Bobby Scott, Sheila Jackson-Lee, and my predecessor as Health Braintrust Chair, Dr. Donna Christensen, discussed last night, to the critical nature of diversifying the healthcare workforce, which the presidents of the AMA, the National Medical Association, and the National Hispanic Medical Association laid out very plainly for us just this afternoon. Just like the work, the fun is not over yet. You are in for a real treat this evening. Shortly, we will be hearing from the 47th Vice President of our nation, Joe Biden, whose Cancer Moonshot initiative intends to reduce cancer disparities through investments in quality research and by galvanizing preventative care. You will also hear from Bernard Tyson, Chairman and CEO of Kaiser Permanente, on his organization's vision to usher in healthcare access practices that incorporate total well-being. And of course, tonight we honor 40 more leaders in minority health. They are our frontliners in clinical settings, at the research bench, in insurance, and in health policy. They are changing lives, they are working on cures, and they are preventing early deaths. And lastly, I'm going to talk 1 second about myself. Tonight, 6 years ago, I won my race to come to Congress. I'm celebrating too. Have a great evening.
So my parents didn't graduate from high school. I was the first in my family, like so many in the room, who got to go to college. And I started college really with no specific direction in mind, except I felt that I needed a degree more than high school. If you told me back there in 1967 that I'd be standing on this stage this evening about to do what I'm about to do, I would say, I don't know about that one. You know what the gospel song says? I'm coming up on the rough side of the mountain. I've had the tremendous pleasure to work with the Biden Cancer Initiative. One of the things I've learned in my journey is that we human beings have the capacity to do just tremendous, amazing things when we set our minds to it. The Biden Cancer Initiative was developed to drive and implement a solution to accelerate progress in cancer prevention, detection, diagnosis, research and care, and to reduce disparities in cancer outcomes. I saw the 47th Vice President of the United States use his voice and his presence to build a coalition of organizations and individuals that could have collaborated a long time ago to solve a problem but had not. And his just sheer power, will, and commitment brought us all together to solve a problem. We can defeat cancer. We can own that reality. And the Biden Cancer Initiative has really made a tremendous contribution. And so it is, I'd like to say it's an honor, but it well past an honor to be able to introduce to you, and probably that's the wrong word too, because you already know who he is, the 47th Vice President of the United States, Joseph Biden.
Thank you, appreciate it. Well, Congresswoman Kelly, glad the voters were smart 6 years ago tonight. And I want to thank you, Doc, Gary. We graduated about the same time, and little did I think I'd ever be standing here as well. Congresswoman Joyce Beatty, Mr. Butterfield, good to see you, pal, GK, and Eddie Bernice. Did they name that station after you finally, Eddie Bernice? It's a long story. I'm a train guy. It's a long story. And look, my sincere appreciation to the Congressional Black Caucus Health Braintrust and the National Minority Equality Forum for hosting this prestigious event. And it is. It's not hyperbole to say prestigious event. It is. Your organizations are of great consequence, and I'm honored to be presented with this award. You know, all of you in this audience have received various honors. You're probably like me. You tend to judge the value of the honor by how high you hold the organization in esteem that gives you the honor. And I can't tell you how much I appreciate you recognizing me. You know, I bet many of these people in this room have had an experience that my family and I have had learning about cancer and how ugly and complicated it is. And the cancer research system and the care system, trying to figure out firsthand, because you've had someone you love and adore be diagnosed with cancer. And it was a real epiphany for me to, when my son was diagnosed with stage 4 glioblastoma, I tried to learn everything I could possibly learn about the disease. And I literally, not figuratively, traveled the world. I traveled to every major cancer facility in the world, but with few exceptions. And I learned over the last 4 years an awful lot. And I learned that there's an incredible opportunity to make significant progress, to make things work better for patients. But I also learned we're so far behind the curve. We should be able to say that the messages of prevention and access to early detection are equally distributed across the cities and towns in the United States of America. But you know, we can't. We should be able to say that affordability of cancer treatment is getting better, not worse, but we can't. We should be able to say that the doctor in Hawkinsville, Georgia, has the same tools needed to treat the cancer of the patient he diagnosed as someone at Johns Hopkins. But you can't. In each of these problems areas and so many more, there's reasons grounded in tradition, in the culture of the cancer community, in history, in personal advancement, that may have been once valid, but certainly aren't valid any longer. And they've been defying change for a long time. But we got to change them. We got to change them. I'm not telling you something you don't already know. Many of you in this room live with these issues every single day. You're the national leaders in the fight for equality of health care and access and outcomes across the country. You know all too well how deep the disparities run. People of color continue to face significant disparities in access and utilization of the healthcare system. You heard Doc talk about the zip codes. It literally gets down to what zip code you live in. Despite coverage gains under the Affordable Health Care Act, and I want to thank the Black Caucus in the United States Congress for fighting so damn hard to keep that alive. Despite the progress we made when it passed, people of color accounted for more than half of the 32 million non-elderly uninsured in the United States. These disparities impact communities profoundly, from birth through old age. You know, compared to white babies, African American babies are twice as likely to be born at a low birth weight, about twice as likely to die before their first birthday. Today, 1 in 5 children grow up in poverty. For children of color, these rates are higher than white children, often twice as high. And poverty generates significant health care consequences. And the death rate of African Americans is higher than whites for heart disease, stroke, asthma, influenza, pneumonia, diabetes, HIV, AIDS, homicide. All of these disparities are pervasive in the area of cancer as well. According to the National Cancer Institute, African American women have the highest rates of death from cervical cancer and are much more likely than white women to die of breast cancer. African American men are more than twice as likely as whites to die of prostate cancer and more likely to get and die of lung cancer than any other racial or ethnic group in the country. African Americans get colorectal cancer at higher rates than white Americans. They're nearly twice as likely to die of stomach cancer. I could go on and on. The fact is the disparities are profound. They're profound. And we can, must, and are able to do something about it. It's within our power. As I said before, it comes down to the fundamental disparity in access and utilization. I know all of you know this. Jill and I have had to experience these stories firsthand as we travel at home and throughout the country. 3 years ago, at the start of my investigation to try to figure out what I could learn about the cancer my son had around the world, the president turned around when I decided that I wasn't going to try to seek the nomination. I walked out. He wanted to walk out in the Rose Garden with me. And I said something spontaneously I had not intended to say. I said, my one regret of not running is I wouldn't be the president who presides over the end of cancer as we know it. The moonshot. And the moonshot was a very significant change that we went through. I met researchers, for example, from the University of North Carolina as I traveled the country. She was trying to find out why African American women are being diagnosed with breast cancer at such late stages, after it had spread, when it was much more difficult to treat. She was searching for answers as to what we could do about that. I saw some of my own experience when I was a senator in Delaware. And my wife had started a thing called the Biden Breast Health Initiative to deal with breast cancer. Doc, in the same zip codes, and we have the 8th largest black population in America in the state of Delaware. And all those zip codes that were African American, it was clear the cancer rates were significantly higher. It's all about early detection. All about early detection. So we significantly increased access to mobile screening devices in African American communities, bringing these vans both to urban and rural populations in these zip codes. What we initially saw was, notwithstanding these mobile mammogram screening vehicles were available, there remained an incredible mistrust in the community, a sense of a stigma to walk up and walk to that van and to get that breast health exam that was done, the mammogram. And so we knew we had to take a different approach. At our Biden Cancer Summit last year, we heard from a man named Elmer Weirda. He leads a prevention program in the Washington Hospital Center. He talks about hospitals needing to serve zip codes closest to them. When he looked at the neighborhoods least served by prevention services in Washington Hospital Center, it was all those neighborhoods closest to the hospital. The unfortunate reality is that the medical system doesn't serve everyone equally. So many of our institutions are shaped and informed by racial bias, implicit or explicit. It's built in, but it's not permanent. It doesn't have to be permanent. We can change this. We can address it, and we're beginning to do so. Doc, I said to you earlier, you're way ahead of your time in focusing on this. I'm not being solicitous. You're way ahead of your time. And it's been a heavy slog for you for a long time. Just last week, my wife Jill was in Atlanta to give a speech to the American Association of Cancer Research, and she went to Morehouse School of Medicine. She saw how a new generation of healthcare professionals are taking on these challenges that have persisted for decades. And she walked away from the encounter much more hopeful that things are beginning to change. What she heard was doctoral candidates in medical studies, each with their own personal story of why they're studying oncology, and each with a steadfast commitment to take on the health equity as a central part of their careers. They told stories about developing new solutions to address disparities in early detection, stories of expanding access to clinical trials to more communities of color, how these docs were reaching back to the grade schools and high schools as role models to say, this is something you can do. It matters. So the next generation of scientists and physicians will be of color as well. It matters. Gary, as you've said, real change lies not in debating whether disparities exist, but in identifying the patients at the greatest risk and developing and implementing local strategies to reduce and eliminate those risks. It can be done. You started this organization more than 20 years ago with a vision to provide optimal health care for a diverse society, to build sustainable health communities. and it provided research and data and partnerships to make a difference. And from recognizing the incredible young leaders in minority healthcare like you're going to do this evening, to partnering with NIH All of Us initiative to bring communities into the orbit of research, bring the whole community in, to focus on bringing precision medicine to patients of colors. Gary, your commitment in identifying and addressing health disparities in communities, in this community, is making a real difference for people. You're saving people's lives. And we were happy, the Biden Cancer Initiative, to work with you. Thanks for letting us partner with you. You know, we delivered on the moonshot commitment as part of the Biden Cancer Summit, working with the National Minority Quality Forum and Sustainable Healthy Communities. And together we released the Cancer Index Atlas. And I'm not going to go over it again, but you went through what it means. Folks, this is a searchable database that allows researchers and other experts to explore what I call the heat map of breast, colorectal, prostate, blood cancer, other cancers. The data can be visualized geographically, patients' demographics, prevalence, and incidences in those areas, with a goal of collaborating to address cancer health equity one community at a time. And by joining forces with the Congressional Black Caucus Health Braintrust, there's no limit to what we're going to be able to do. The Health Braintrust theme of the 114th Congress is, and I quote, "A march toward health equity," in honor of the 50th anniversary of the Voting Rights March from Selma to Montgomery, and aligning with the overall goal of equating, calling for equality for African Americans across the spectrum in this country. Healthcare is about life. You can't enjoy life very well with bad health. So we're going to continue to address these quality questions. And the Black Caucus defending the Affordable Care Act, as I said, and supporting Medicare expansion by creating community-based health disparities and tailoring health messages across generations. And it varies from generation to generation what has to be focused on. 3 years ago, when President Obama announced in his final State of the Union that, and he loved doing this, he'd never tell me what he was going to assign me. No, not a joke. He thought it was really cool. And he said, and we're going to put Joe Biden in charge of mission control, the moonshot. Well, you know, what happened was when we did a lot of good work with your help in the moonshot. And when we left, I went to this administration and said, you can do a lot, move, but it wasn't their priority at the time. And so 21 heads of major cancer hospitals came to me, 5 Nobel laureates, a group of people that, some of the leading people in the research area, and said, would I start a Biden Cancer Initiative? And I said, why? I'm not a doc, I don't have that expertise. And a gentleman at MIT, who you know well, Gary, looked at me and said, Joe, he said, you do 2 things better than anybody. You can convene and you can embarrass. And I thought, what a hell of a moniker to have. I can convene and I can embarrass. But look, from the beginning, I was straightforward about what this initiative was about. There were 2 overwhelming focuses that we had in this whole area. And the first and foremost was to maintain the urgency of now. The urgency of now. What began to change was this went from an objective to a movement. It's become a nation and worldwide movement. 10 countries have signed on with us to share data. You know, when President Nixon declared the war on cancer in 1970, he meant it. He was sincere about it. But he had no army. He had few tools. And the image was that this is going to be like Jonas Salk going into a laboratory and finding the silver bullet. That was going to be the answer. We didn't have the ability at hospitals back then to share data, let alone an inclination to share data. And everything was built around that model. That was the model. But here we are, over 50 years later, about 50 years later, and we have so many more tools. We can share data by the click of a mouse. We're in a position where we can do 1,000,000 billion calculations per second. Imagine if you're able to aggregate every cancer genome that was sequenced in the United States, let alone the world, in one place. I could tell you what 10 Nobel laureates wouldn't be able to tell you in 5 years. Why a particular therapy worked on you and not on you when you had the same cancer. Back then, we thought there was a single cancer residing in different parts of the body. We now know there are at least 106 different cancers requiring different therapies. We have all these tools available. I found out when I did this research that all the NIH money going in billions of dollars over the years in cancer research. If you are an astrophysicist and you want to study the seventh ring around Saturn, and you get $50 million a study, the day you finish your study, you got to publish it for the whole world to see. I found out docs are supposed to do the same thing, researchers, the same thing with the cancer money. But I found 82% never published their findings. They're not good at playing in the sandbox together and sharing data. But it's changing. It's changing in a big way. When we set up the cancer, well, I won't go into it, but there's just a whole lot that's changing right now in ways that, I can pick up my cell phone and find out what movie is playing in a movie theater in Bemidji, Minnesota today. Try it. You can do it. But you cannot find for me where a cancer trial for your particular kind of cancer is being conducted that you could become a part of and maybe the only means to save your life. Why? Why? What possible technological reason could there be? Folks, we have a collective responsibility to do better for patients. And we are. We've come a long way. You know I'm going to end this because this has become the cause of my life. Guys, if you're in a situation where you know the cancer you have, a lot of docs, as Guy can tell you, are beginning to think maybe the answer to some of these cancers is like what we did with AIDS, multiple drugs, not just one drug. But up until a couple of years ago, if all of you at this table were individual drug companies working on a particular cancer with the same drug that hadn't been proven yet, you're going to spend each of you a whole hell of a lot of money. So I said, why don't we have a formulary? Why can't we do something about that? So NIH came along and said, as Gary knows, we're going to assign a monetary value to each of the proposals you guys have. So you know ahead of time, if a cure is found, you get 2, 10, 20, 30, 50% of it. And so now these drug companies are putting their drug on the table, all of them, for particular cancers, and any researcher in the world can come in and use them. We've worked out the insurance side of it, and we worked out the remuneration side of it. And now tens of thousands of experiments are taking place. The likelihood of finding cures has increased exponentially. Exponentially. We did the same thing. We used to have a cancer formulary where a cancer, at NIH, you could find out there was about 70,000 cancers where we had the biopsies and all the material, all the cancer genomes done and all the rest. And I said, why don't we move that out into the University of Chicago and then get all these other outfits, including 9 countries we signed agreements with, to send all their material into that particular facility. And anybody is allowed to access it. Anybody. In the first 6 months, 8 million times it was accessed. Increasing exponentially the prospect. Something is going to be found. Folks, there's much more to say, but I've already said too much. We can't claim victory yet. We can't claim until the solutions we're developing are standard, not the exception. Until we've changed things we can't accept. We can't accept disparities in outcomes by race, gender, and zip code. We can't accept unaffordable treatments. We can't accept clinical trials. For clinicals are the fact that to get a clinic, only 1 in 10 people have access to clinical trials. We can't accept business as usual practices in research and care when there's nothing unusual about a cancer diagnosis. We can't accept efforts to roll back the opportunity for all Americans to have affordable and meaningful health care. When President Kennedy described sending a man to the moon, he talked about a commitment. And you all know the speech from high school. But the phrase that sticks out with me, and I mean this sincerely, is he said, we're doing this because we are unwilling to postpone. We are unwilling to postpone. The fight against cancer, the fight to eliminate racial disparities in cancer and outcomes is a fight we have to be unwilling to postpone. And the last thing I'll say is this, folks. One of the things that has disappointed me in the last 6, 7, 8 years is that growing up, most of us were taught this is America. We can do anything if we set our mind to it. But now we kind of walk around like, woe is me. What are we going to do? I am convinced as we make significant progress in cancer, the only truly nonpartisan issue facing this country, that the rest of the nation is going to say, damn it, we can do anything. This is the United States of America. This is fully, thoroughly, totally, completely within our wheelhouse. And you started in a big way, Doc. Thank you, thank you, thank you, and thank you for this great honor. We can do anything. We can do this. Thank you.
Mr. Vice President, we still love you, sir. That was fantastic. Calling back to the stage our founder and CEO, Dr. Puckrein, who will... we should first acknowledge the gentle lady who has arrived from the great state of Ohio, Columbus specifically, where I understand they have a fantastic Budweiser factory. Congresswoman Joyce Beatty, ladies and gentlemen. Coming to the stage, the Congresswoman from Chicago, Robin Kelly, who you heard from earlier, as well as Dr. Puckrein, to introduce our Lifetime Achievement Awardee.
Thank you. One of the lessons I've learned is that in this country, one of the places where change occurs, and we don't think about it often enough, is in the marketplace, where we build and come and collaborate. And in our community, where we have so much further to go in terms of building healthy, sustainable communities. One of the leaders that we are deeply proud of is Bernard J. Tyson, the chairman and CEO of the Kaiser Foundation Health Plan. His organization, we affectionately know as Kaiser Permanente, is actually covering 12.4 million lives in 8 states and the District of Columbia. It is through his work and the work of his organization that we can begin to make deep change. He may not know it, but I started working with Kaiser Permanente back in 2005. I was about 17 years old then. I was early in the journey of trying to understand down at the zip code level what was happening to African Americans. And he may not know it, but Kaiser partnered with us to allow us to begin looking at, so why were the levels of diabetes and diabetes hospitalization so high? I'm not going to give you a lot of numbers. I'm going to give you just one set of numbers from back then that sort of gives you a sense of what we were dealing with and what we continue to deal with. An African American with ischemic heart disease had a 90% hospitalization rate. 90% of every African American who was diagnosed with diabetes and had ischemic heart disease in those 2,500 zip codes that we spoke of were being hospitalized every year, which is an insane number, absolutely insane number. And I worked with the Kaiser Permanente staff, and we began to explore what was driving those numbers, and I've been deeply appreciative. That was a real learning experience for me. The Vice President said something that I bring to this conversation right now, which is we have the capacity to do anything that we actually want to do. And in our organization, what we talk about is controlling health outcomes in 2,500 zip codes. We don't talk about health disparities anymore. We think in the 21st century, we can actually control the number of people who end up in the emergency room, in hospitals. That's our future. And I've watched and we've worked alongside the Kaiser Permanente family, and we are so appreciative of him leaving the West Coast and coming over here to the East Coast for this evening. Ladies and gentlemen, really with great pleasure and honor, I give you Bernard Tyson, our Lifetime Achievement Award winner. Thank you.
Thank you so much. Good evening, everyone. It's an honor and a privilege to be here this evening and to accept this award. I can't tell you how excited I have been to be here on this evening, and what an honor to get this award also with the Vice President, Joe Biden. I had the privilege of speaking to him in the back and taking a couple of pictures, and I said to him, "Are you going to announce tonight?" Because if you're not, I am. I was in Iowa last week. My first trip to Iowa. I was scheduled to do a day at the University of Iowa. So when I got off the plane, I told my colleagues who were with me, I said, so this is Iowa. And then I told the driver, I said, so this is the airport of Iowa. And we were going down the street, I said, this is the road of Iowa. And then when we got downtown, he said, sir, we're downtown. I said, this is downtown? This is Iowa. So given last week and this week, who knows, next week, maybe I'll be the second or first person. I don't think so. I'm enjoying healthcare too much. I can't tell you how privileged I am to be here on this evening. And at the same time, we have so much more to do to make sure that everyone has an equal opportunity to succeed in life. And we talk about it that way in Kaiser Permanente. It does not mean that everyone is going to have an equal outcome in life, but everyone should have an equal opportunity in life. And we believe to have the best chance, you need at least two things: good health and a level playing field. And that's what we work on. We happen to believe that anyone who has to go to bed on the streets of America is unacceptable. Because how can you have good health living on the streets of America? And so for Kaiser Permanente, homelessness is part of our health agenda. And we feel like on our watch, no one should live in those conditions. I'm honored to have a member of our board here on this evening. I think everyone in the room knows her. She's the past Surgeon General, Regina Benjamin. She's in the room. And also the president of the Mid-Atlantic region, Kim Harn, is in the room as well. I want to thank you for this award, but I also want to tell you in no way do I feel like we are finished with the work that we have ahead of us within Kaiser Permanente. It's a wonderful organization. I am privileged every day to serve in the capacity as chairman and CEO. And with this role comes a lot of wonderful opportunities and a lot of wonderful challenges. You may have seen some of the drum beating outside prior to coming in. It's all in the family, everybody. It's all in the family. But I am honored to have wonderful men and women who work every single day at Kaiser Permanente, no matter where we might have agreements or disagreements, for the betterment of healthcare in this country. And it's a privilege to serve in this capacity. The last thing I want to say, and one of the initiatives that we have in Kaiser Permanente, we're opening up the Kaiser Permanente Medical School on next year. Yes. In Pasadena, California, we're specifically targeting people of color in addition to the majority population. We're going to pay for the first 5 classes to go to medical school. I've often talked about this. My lifelong desire has always been to be a doctor. I've been hinting about being accepted into the medical school, but so far I've had no takers to sponsor me. But our goal is to see to it that we're helping the future generation of physicians and physician leaders in Kaiser Permanente for the rest of the world. I believe strongly that the very idea that someone might have to suffer longer simply because of the color of their skin or the neighborhood in which they live is absolutely unacceptable. Period. And I'll leave on this note to my colleagues in the 40 group. I had an honor to talk to them for a few minutes before coming in, and I'm still very young. But I must admit, as I looked at the 40, I'm going to work out a little longer tomorrow. Because it's clear they're energized to change the world, and that's what we need. I often tell this story about my late father, who was a great man, role model, someone that I think about every single day. My father and I were in Hawaii, and some of you may have heard this story. We're walking along the beach. I had graduated from school. I had started to grow up in Kaiser Permanente. I was feeling good about myself. I was on a good road. I took my parents to Hawaii because they sacrificed so much for me. I wanted them to see that, you know, I'm on my way, Dad, Mom. I've arrived. So we were walking along the beach. My father, who was a minister, got into one of his moods, and he said, you know, this is a beautiful place, son. I said, yes, Dad, it is. He said, I never thought in my life I would see anything like this. I was feeling great. Yeah, Dad, it's for you, man. You helped me. He said, man, I didn't know people lived like this. I said, yeah, and we're here now. He kept going, and he kept going, and he kept going. Then I started to feel another thing, that maybe I went overboard. Maybe I was too arrogant. So we were walking along, and I said to my father, I said, hey, Daddy. I said, you see all of this? My father said, yes, son. I said, I have problems like everybody else. My father looked at that water, pondered what I said for a moment, and he said, this is true. But the difference is, people like you can take your problems to places like this. That has stayed with me throughout my life and throughout my career. And I want to tell all of the great leaders in this room, you're in places like this. The question is, what do you do? Because you'll sit at tables, you will interact with people, you will be in positions of power that you can impact one life or millions of lives. And as you get into places like this, stand up and be counted, because there's a whole generation of people that sacrifice for us to be where we are today. And I honor my generation. That goes all the way back to slavery. And I will honor them by speaking truth to power, because I am in a place like this. Thank you very much.
We've witnessed history tonight. It should be noted that Mr. Tyson is one of less than 5 African American CEOs of Fortune 500 enterprises. What a lifetime achievement awardee. As our 40 under 40 conferees gather in the other ballroom, we'll make a quick announcement. Congresswoman Kelly mentioned it a bit earlier, but my good fraternity brother and our dear friend, COO of the NMQF, it is his birthday today, and he is spending it working. So we have a little something that our friends on the staff have helped us prepare. If you all could help my non-singing self and join me in a rendition of Happy Birthday for our dear brother, the COO, Brother Brandon Garrett. Happy birthday to you. Happy birthday to you. Happy birthday, dear Brandon. Happy birthday to you. Fantastic. Thank you all. But as we can, are we ready to present our 40 under 40? Okay, we'll give them just a moment. So I will think of ways to convince Mr. Tyson that he's my biological uncle. He's so cool. I was speaking with Brother Wilson here, another vice president at Kaiser Permanente, and it should be noted that while they provide insurance to 12.5 million Americans, they provide a holistic healthcare platform to 65 million Americans. That type of care is done from a nonprofit, and that is because the leadership has decided that it's about more than just profit, that we have a mission to provide health care. So kudos once again to not only Mr. Tyson, but all of Kaiser Permanente, Madam President, Brother Wilson, and all of you all for the work that you do for our shared obligation as the Vice President described it. Mr. Puckrein is going to join me as we confer our 2019 40 Under 40 awards. If we could reconvene, ladies and gentlemen, we can proceed with conferring our 40 Under 40. We are very, very proud of these people who are not only the future, but the present of not only minority healthcare, but global healthcare leadership. Congresswoman Dr. Puckrein will join us one more time to confer our awards. First, recognizing 4 awardees who are not with us this evening: Dr. Adewole Adamson, Harry Cho, Andrew Gentles, Ali Khan, and Chase Smith. Congratulations to them in their absence. Please feel free. And to those of us who are with us, will be joining us on stage right now, please give them a warm welcome, and I will do my best to work with some challenging names. The Assistant Professor of Dermatology at the Johns Hopkins School of Medicine. Congratulations, Dr. Crystal Agu. A family medicine physician from Centricare Health, Dr. J. Cherie Allen. Congratulations. The Community Lab Coordinator from Biogen Incorporated, Alazar Alaye. The Director of Network Strategy and Provider Solutions at Magellan Health, Brandon Batiste. The Assistant Professor at New York Medical College, Dr. Kiosha Bond. Assistant Professor of Medicine at the University of Arizona College of Medicine at Tucson, Dr. Khadijah Breathitt. An Assistant Professor at Georgia State University. Congratulations, Dr. Sierra Carter. The Medical Director of Adult Inpatient Services at Greenville Health System and Marshall Pickens Hospital and Prisma Health, Dr. Frank Clark. Look at them shoes, yes sir. The Assistant Professor, he tried to take his time too, didn't he? The Assistant Professor of the Department of Internal Medicine at Congresswoman Beatty's The Ohio State University Medical Center. Congratulations, Dr. Lanla Cote. The Program Director of Endocrinology, Diabetes, and Metabolism Fellowship at the University of Arizona College of Medicine at Phoenix and Phoenix VAMC, Dr. Ricardo Correa Marquez. The Assistant Professor of Medicine at the University of Pittsburgh School of Medicine. I could have used you earlier today to help tie this bow tie, brother. Congratulations, Dr. Utibe Essien. A pediatrician and assistant professor of pediatrics at the Children's National Health System and George Washington University School of Medicine and Health Sciences. Congratulations, Dr. Kofi Essel. Medical Science Liaison and Genetic Counselor at 23andMe, Dr. Altavice T. Ewing. The Senior Director of Health, Equity, Partnerships, and Programs at the Association of American Medical Colleges. Congratulations, Dr. Malika Fair. The Assistant Professor at the University of South Carolina, Go Gamecocks College of Nursing, Dr. Tisha Felder. The Clinical Assistant Professor at the University of Iowa, Mr. Tyson's been there, Hospital and Clinics. Congratulations to Dr. Kanyizi Ferguson. Woman after my own heart, the Senior Congressional Lobbyist for the American Dental Association, Dr. Jennifer M. Fisher. The Senior Regulatory Product Manager at the Food and Drug Administration, Lieutenant Commander Andrew Gentles, Doctor of Pharmacy. And that is not Dr. Gentles. A pediatric physician at the Fairfield Medical Center. Congratulations, Dr. Michelle Gola. An assistant professor at the Harvard Medical School. Congratulations, Dr. Hesham Hamoda. The Director of Care Research Center at Mass Gen, Massachusetts General Hospital. Congratulations, Dr. Jonathan Jackson. A human geneticist at Illumina. Congratulations, Dr. Janina Jeff. The T32 post celebration. The T32 postdoctoral fellow at Ohio's own Case Western Reserve University. You're on duty again, Congresswoman Beatty. Congratulations, Dr. Shanina Knighton, PhD and registered nurse. A medical doctorate and medical science student from UC Berkeley, UC San Francisco's joint medical program. Congratulations, Bernadette Lim. Got it. A resident family physician at the Duke University Health System. Congratulations, Dr. Alexa Mieses. National Clinician Scholar at the University of Pennsylvania Perelman School of Medicine, Dr. Priscilla Michelle Mpasi. A neurosurgical oncologist at the National Institute of Health. Congratulations, Dr. Eja K. Nduam. A health policy analyst at the Centers for Disease Control and Prevention, Ms. Jennifer Rutledge Petit. An assistant professor at the University of Colorado Ann Schultz Medical Campus. Congratulations, Dr. Emira Del Pino Jones. An assistant professor of pediatrics in the Division of Psychology at the Nationwide Children's Hospital. A lot of Ohioans tonight. Ohio is cleaning up. OH10, stand up. An assistant professor of pediatrics in the Division of Psychology at the Nationwide Children's Hospital and the Ohio State University College of Medicine. Congratulations, Dr. Whitney J. Ragland Bignall. Mr. Butterfield? Back up. An assistant professor of health policy and management at the University of North Carolina, Chapel Hill, Gilling School of Global Public Health, Dr. Cleo A. Samuel. What is a Tar Heel anyway? Congratulations, Dr. Samuel. No shade intended. Congratulations. Tough room. A pediatrician and medical director for Impact DC at the Children's National Medical Center. Congratulations, Dr. Ankur Yogesh Shah, MD, MBA, and MPH. An associate professor of clinical and emergency medicine at SUNY Downstate, Kings County Hospital. Congratulations, Dr. Teresa Y. Smith. The senior public health advisor at the Food and Drug Administration Office of Minority Health, Dr. Javoni R. Spinner. an assistant professor at the George Washington University right here in Foggy Bottom. Congratulations, Dr. Miranda C. Ward. Ladies and gentlemen, as we ask all of our conferees in this year's class of 40 under 40 to rejoin us on stage for one final photo, please, ladies and gentlemen, give it up for the 2019 class of NMQF 40 under 40. On behalf of Dr. Gary Puckrein and all the staff and friends and associates of the National Minority Quality Forum, all of the members of Congress assembled, and especially our 40 under 40 who represent not only the future but the present of healthcare and healthcare outcomes, thank you all so much for joining us. We'll see you next year.